Hey everyone, I'm Russ from Wealth Care for Women. Part of the work I do is increasingly addressing a big concern among people in the pre-retirement and retirement community, which is the bulk of the clients I work with, and that's around healthcare costs, both now and in the future. And to that end, I have partnered with a firm called Caribou and have been working with them on behalf of my clients for the last several months or so. With great results and great feedback from clients like you. Today, I'm happy to be joined by one of the co-founders of Caribou, Christine Simone, who is going to cover some information and provide some education around how to plan for healthcare coverage and costs if you retire early. And in this case, we're talking primarily retiring earlier than 65. So Christine, I'm happy to be joining you today and look forward to you sharing this information with us.
Thanks, Russ. I'm so glad to be here and appreciate the opportunity to speak to your clients and provide them with this really valuable information. You definitely have a really comprehensive approach to the planning that you do, and we're lucky to be a partner of yours and get to work with you as well as your clients, because we certainly know and have heard from them directly that there is a big need in this area. So as Russ mentioned, my name is Christine. I'm one of the founders of Caribou, and we work exclusively with financial advisors and their clients to help them plan for transitions very similar to the ones that we're going to talk about today. So today will be tailored around that pre-65 milestone of what happens if you're thinking about retirement before Medicare eligibility. So whenever we refer to early retirement, we typically mean pre-65. And this is just one of many life events that we, as well as Russ, can support too. So by no means is the healthcare conversation only limited to whether you're retiring before the age of 65 or not. So do reach out if you're asking for assistance with Medicare, or if you're moving, or other life events as it might relate to your personal situation and if it impacts your healthcare costs. So today we're going to be going through a lot of content. Hopefully it's easy to understand and digestible. You can always refer back to this recording. We're going to start with the importance of planning for healthcare if you are retiring before the age of 65. We're going to talk a little bit about the differences between group plans, which is also known as your employer plan, and the individual insurance market. We're going to talk a little bit about options for early retirees. So what health benefits options do you have accessible to you? Briefly touch on HSAs, and then talk about timing and enrollment to make sure that you don't have any gaps in coverage if you're transitioning from one type of plan to the next. So to put this whole conversation into perspective for those who are watching, you may be planning your retirement early, pre-65. You might be going through it right now, or you might be in it, meaning you might be looking to evaluate other options. For those who are thinking about it and planning for it, know that less than 1% of Americans retire before the age of 50, but 51% retire between the ages of 60 and 65. So there's a large portion of the population that is in this situation where they are needing or have questions about their health insurance before Medicare eligibility and after an employer might provide you a group plan. Now more than ever, people are retiring earlier and earlier. Clients that are watching this, you might be, scattered around the United States. Every state actually has a different average retirement rate. It might vary from 60 to around 64 or even 65 in some states. And partly that is because of the cost of healthcare. A lot of clients or just individuals in general might be more likely to hold on to their health insurance through an employer if the cost of health insurance is really expensive in their county or their state, for example. The pandemic certainly forced people into retirement sooner than planned too. And I think what at least we've seen recently with the current macro environment too is that some people are actually choosing to return back to work. So lots of moving pieces. There's no such thing really as retirement in the standard or more general way. Some people are floating in and out of work a lot more frequently than they used to. To add to that, the length of retirement is getting a lot longer, meaning if you retire early, you are retired for longer and longer. So that does impact your healthcare costs and what you're going to pay if you have, depending on the different options that you have available to you. And then when you or anyone is thinking about that retirement milestone, one of the biggest concerns is healthcare costs. So if you're in that boat, don't feel like you're unusual. It really is one of the top concerns for most Americans. Some people who tend to retire early, just by some statistics, it might be because of the change in their health status. It might be because they have a defined pension benefit. It might be because they have certain limitations, either based on their health or not based on their health in just general activities of daily living, or it might be because of the stress of their job. Note that your assets actually are very rarely an indicator of when you might retire. There's certainly people who are high income earning who work well beyond the age of 65. And the reverse is also true, that they might retire a lot sooner than others. I touched a little bit on this already, but so that I can kind of put it into perspective with some data, the majority of adults, and this is age 25 and above across different generations from millennials to Gen X to boomers, state that healthcare is their top fear in retirement. But where there is some misalignment is that only a slight majority know the amount required to cover healthcare costs when they are in retirement. So that's again where the folks watching this, you guys are lucky over us to walk you through this, really paint that picture and start to plan for it as early as possible. There are some benchmarks that you can kind of keep in mind if you're thinking about this well in advance. The average couple will need just over $300,000 for healthcare costs past the age of 65. This varies for men and for women, so that is for a couple. $150,000 for men, $165,000 for women. And this does take a lot of assumptions into account. So it does take into account that you're on Medicare and that you have a Medicare drug plan as well. It does not include any costs if you are thinking about retiring before the age of 65. So that's where sometimes these cookie cutter estimates or surface level kind of predictions don't necessarily work if you have other factors coming into play, like retiring early. So when you're retiring early, we'll get into some of the different options that exist for you. But one of the first key things that is worth addressing is what the difference is between your employer benefits and the options available on the individual marketplace. So roughly half of Americans have health insurance through employment. It's the biggest source of insurance other than Medicare. And one really key thing to note is that employer plans are very often heavily subsidized, meaning that the employer is covering a big majority of that premium for you. You might have noticed on your pay stub, or you might have noticed in your initial signing package when you first got your most recent job, what that percentage was. But for sake of just some industry standards, 78% of premiums for a single individual is typically covered by the employer. So that's for the employee themselves. And then 66% on average of premiums are covered for the family. So that is a very big portion of the premium that, you might not be used to covering. And that becomes very evident and sometimes can be quite a big shock to people when they're leaving active employment and transitioning into retirement, is that they didn't really realize how expensive health insurance was. The good news, though, is that the American Rescue Act, which was a result of the pandemic, has increased recently in 2020. I think 2021 was the first official year. Maybe there was part of 2020 as well, where the premium tax credits were available for those with a higher income level. But it has made some very modest households eligible for a tax credit. So that does reduce the total premium that you might be subject to paying. This is based on where you live, so the specifics of your exact zip code and county, the size of the household. So that's actually not the same thing as the number of people who are planning to get covered, but it's actually just how many people are filed on that tax return and live in that household, and then your income as well. So this has been extended into 2025. Originally, it was to last until 2023. The good news is that they did extend it an additional 2 years. So this income level is well above the poverty line that it was at previously, I think to the amount of about 400% more. So to put this into perspective with a real case here, if you have a family of 4 living in Miami-Dade County with an income joint as a household of around $125,000, you have one individual who's 55, the other spouse is 53, and let's say you have 2 kids, 22 and 19 respectively. The age actually doesn't matter, but just so you know, this was a real household living in this county and accessing a premium tax credit of close to $1,400 a month. So really big tax savings here to tap into, and it really is bringing that premium down to in and around the same amount that you might expect from an employer. So much more comparable from that context from direct premiums. Now, where there's a little bit of a difference, and it's actually quite a substantive difference, is in the possible deductibles and out-of-pocket maximums. There's a different way that these numbers are calculated. The pools that the insurance company bases it off of are very different in sizes. So your employer pool is a lot smaller, whereas the pool of the public marketplace is a lot larger. And so they're basing some of these numbers off of that sample size, essentially. You can see deductibles and out-of-pocket maximums in the individual marketplace to be north of $18,000 this year. Last year, it was around 17. This year, we've seen it hike up to around 18. It's been a pretty consistent trend that around $1,000 or so a year is that increase that you see in the possible out-of-pocket maximum and possibly the deductible itself too. For sake of comparison, the average deductible for an individual, if you have an employer plan, is around $1,700, and for a family, it's around $3,400. And if you're considering the out-of-pocket maximum, around $4,400 for an individual, and $8,300 or $8,400 for a family. So this is a really, really important point here, because the fixed costs, so what you pay in monthly premiums, might be very similar to what you might have been experiencing from your employer. But the big difference is in the possible variable costs. And that's how we define it. You can define it as variable costs. You can define it as total possible risk. And what that means is if you access healthcare services, you're responsible for paying up to that deductible before your plan kicks in. Then your plan kicks in, but it doesn't cover 100% of the costs until you've reached that out-of-pocket maximum. So you could be subject to up to $18,000 in healthcare costs, and that's non-inclusive of your premiums while you're on the individual marketplace. So we're going to get into kind of how that factors decision-making in a little bit. This does show you an example. So you can see here, might be really small to see, or it might be big enough if you've got it in full screen. You can see the original price of the monthly premium listed here. You see the tax credit applied. So monthly, this family was paying $273.42 for their coverage, which is probably not far off from an employer plan's coverage. But you'll see here we've got a really high deductible as well as a really high out-of-pocket maximum. So if you want to scale those numbers down, that's where you'll pay more in monthly premiums. And that's actually impacted. The way that you can determine that is through the metal tier. So this is what's referred to as a bronze plan. Bronze plans have the lowest premiums, but the highest deductibles and out-of-pocket maximums. As you go up in metal tier, like silver, gold, and even in some counties, there are platinum plans available. That's where you see the premiums go up and the deductibles and out-of-pocket maximums go down. You don't need to remember this or memorize it. Siri wants to chime in. You don't need to memorize all of this. This is all included in a health planning analysis. When you go through it, looking at these different metal tiers is certainly an option, and identifying or aligning your risk profile with these different metal tiers is also included in the analysis too. So we do our best to really walk you through these key differences so you don't have to memorize all this. But this is an example that shows if you really want to get those premiums low, you could be subject to higher deductibles and out-of-pocket maximums. And that really is one of the key differences of employer versus individual marketplace plans. You'll also find that the premiums do increase as you age. So age, smoking status, and sex are the three things that the insurance companies are able to base the premiums on. Insurance companies cannot ask you about any pre-existing health conditions. That's still a really big misconception, I think, generally speaking, across the country, is that if you have any type of health condition, the individual marketplace isn't the place for you. That's not true. All they'll ask is if you smoke, how old you are, and your sex at birth. Those are the three things that will determine your premium, in addition to where you live. So the specifics of where you live. So you can expect that your premiums at 60 will be different than your premiums at 61, at 62, 63, 64, until you age into Medicare at 65. So that is something to account for as well. You can see here an example of this. At 59, we have somebody on a bronze plan. There's no premium tax credit factored into these costs here. But you can see a bronze plan at 59 might cost around $1,000 a month. At 64, it's over around $1,100 a month. So about a $250 increase here between these plan options. For silver, it's interesting because you can never rely on exact patterns and trends. You see here it actually went down, which is interesting to see. This could be a factor of what income was inputted, what cost savings plans might be available. But for gold, you'll see the pattern continues. So healthcare is all full of surprises always. This might be because of some of those factors, but you can expect some of these costs here. You'll see here too, oddly enough, the gold plan is actually less than the silver plan at 59. Again, the way that the insurance companies rank actuarially these costs is very data intensive. So there's probably some data that leans the insurance company to price these plans this way. Some other things to note that are very different from an employer-based plan to the individual marketplace is access to provider networks. So in the employer as well as in the individual marketplace, you have different plan types. You might be familiar with the acronyms PPOs, HMOs, EPOs. These are all different ways of accessing different networks across the country. Depending on where you live, some states on the individual marketplace don't offer PPOs. It's actually about half of the states that don't offer PPO plans. And who that becomes a concern to is people who have multiple residences, people who cross state lines to access care, and people who want to access specialists without the need for a referral or a prior authorization. So if you're not familiar with what a PPO is, what it does is it provides out-of-network benefits and a cap on those benefits as well. Meaning that your plan restricts you to a certain network of doctors, but you can actually go beyond that network and not be exposed unlimitedly to healthcare costs. If you're on what's called an HMO, you have your network, but if you go outside of that network, your insurance company says you are responsible to all costs incurred from any provider you seek outside that network. So it's something to definitely keep in mind, and it's something that, causes some people to really hang on to their employer plan, is that if you do have multiple residences, as in you live in different states for parts of the year, if you cross state lines to see different doctors, very common in the Northeast, for example, or if you really don't want to be restricted by referrals or prior authorizations, that could be a reason to hang on to your employer plan or go with one of the other options that we're about to discuss as well. So let's get into that. There are actually 5 different options that you can consider when you retire. Based on what we've talked through so far, we've mostly been talking about the individual marketplace, which is this third option, also known as the public exchange or as Obamacare. But there's actually 5 different options. There's actually a few extras too that I'm going to throw in at the end as bonus, but they come with a completely different risk profile. And I'll be sure to walk you through what that means. So let's start with COBRA. COBRA is a funny term. It's an acronym for a long law that was passed. The most important part of that acronym is the C, which stands for continuation. So COBRA is the continuation of your current coverage, meaning your most recent employer. You may or may not qualify, or the employer itself may or may not qualify for COBRA. Usually you need to have 20 or more employees to be eligible to offer your employees COBRA coverage if they do leave. And this coverage lasts for about 18 months typically. It can be extended up to 36 months. And what happens is that you are responsible for 100% of your employer premium. So you are basically getting the right to extend your employer coverage for 18 months, sometimes 36, but you're responsible for 100% of the cost. It's actually even 102% of the cost because there's a 2% administration fee. So if you're curious about what COBRA might cost you, you can actually go and look at your pay stubs, take a look at what your employer has deducted from their portion of the health plan premium. So what are they paying versus what are you responsible for paying? This can also be accessed through your initial signing package that you had with the employer, or you can request the document from your HR department. But I know that a lot of people don't necessarily want to hint to their HR department that they are thinking about leaving or retiring. So COBRA is one of the more expensive options, but it does provide a suitable option for a few people. The first situation is if you've already met your deductible. So if you're late in the year, or actually I was just talking to a client, we're only in the month of April right now when we're recording this, but there's a client in this situation where they actually have already met their deductible for the year. And so that is carried over through to your COBRA coverage if you do retire. So if that's the case, it might make sense financially for you to opt into COBRA rather than transitioning to the individual marketplace. Additionally, if you have a provider network, meaning doctors and hospitals that you want to keep and see, and you know that they're covered from your employer plan, then that's also a reason to consider COBRA. And then if that 18 months brings you the full way to Medicare, that might also be a really good reason to consider COBRA as well, just so that you aren't bouncing around from a bunch of different health plans to the other. It provides a more seamless transition from one to the other. The next option is a spouse's plan. So if you're married and you're eligible for a spouse's health plan through their active employment, then that could be a really good option. Some things to consider, though, is that you as the spouse might not be subsidized. They cover the active employee and the spouse often differently, and it might not always be available. Some employers don't offer any spousal coverage, not even the ability to add them to the plan at 100% covered by the employee. So that's really up to the employer. So ask the HR department of your spouse if that is an option for you. That might be a good option to consider if the premium is heavily subsidized. Otherwise, especially while the tax credit is available, it's likely to be more expensive than the options available in the public marketplace. You might, though, have a much lower out-of-pocket maximum or deductible. So that's definitely something you want to factor into the analysis, and it's part of the analysis that we do. And again, it might be less provider disruption than a marketplace plan. You might have already been on that spouse's plan in the past, let's say, or you might be familiar with the doctors covered because you know where your spouse goes to the doctor, for example. So less differences in changing around your provider network. The third option, which we've talked about already in quite a bit of detail, is the individual marketplace, also known as the public exchange or Obamacare. The way that you access the individual marketplace is through a website called healthcare.gov. There are some states that do have their own state-specific marketplace. There must be at least 20 or so states where that applies, and the website will redirect you if that is the case for where you live. So the individual marketplace is available to anyone. Again, no one is excluded, not even individuals with pre-existing conditions. And there's subsidies available, as we've talked about in detail, and you can ensure that that is ACA compliant coverage. So Affordable Care Act compliant coverage, which is a really important factor when it comes to some baseline benefits. I'll talk a little bit more about that when we get into some of the more alternative options available to pre-65 retirees. But what that really guarantees, the most important thing, is that you won't be denied coverage for a pre-existing condition. It's important to consider the marketplace. If the plan that you might be considering is less expensive than COBRA or spousal coverage with the same adequate coverage, most of the time coverage is identical. Again, if it's Affordable Care Act compliant, there are 10 basic benefits that it will cover across the board, across all of these different coverage types. So usually the most important thing is costs, deductibles, and out-of-pocket maximums, and then provider network disruption. If you are not 18 months from Medicare eligibility, it's inevitable that you will probably need to transition to the marketplace anyways. So some people do prefer to just go straight to it rather than going to COBRA and then going to the marketplace and then to Medicare. It's an important option to consider if you are looking to access an HSA compatible plan. So that may or may not be an option for you from your employer. Through COBRA, you can continue on an HSA compatible plan if that was in fact what you were enrolled in. Same applies for your spouse's coverage, but if you don't have access to that, the marketplace has plenty of HSA compatible plans, and we'll get into the details of what that means from a tax savings standpoint a little bit later on. And then what the marketplace does guarantee you, as does COBRA and as does your spousal coverage, is an absolute cap on healthcare costs. And we'll get into that in those more alternative health plan option examples in terms of what that really means. But what it means is that if you access services within network, you can guarantee that you will not pay above a certain amount, and that certain amount is your out-of-pocket maximum. Moving into off-market plans, which are also referred to as private plans, these are available to anybody. It basically means that you are contracting directly with the carrier or through an agent, and they're kind of crafting a plan especially specific to you and your needs. So if they have the capabilities to do that, they can put you on a small group plan, for example, or add in additional perks and benefits. And because of that, usually the price is a lot higher. That's really only the key difference. You do want to ensure and ask that the plan is ACA compliant if you are accessing a plan available through an agent, to make sure that you're not being put into kind of a junk health insurance plan. But some people do explore this option because they won't qualify for a premium tax credit anyways. They like to work with an independent agent, maybe because they've had a relationship with somebody, for example, and they may not want to provide income information to an insurance company. So those are really the only reasons that you might consider it. Most often, people don't know that the plans available on the public marketplace are similar and often less expensive than going directly to an agent. So it's kind of another misconception in the industry. Last, we have pre-65 retiree benefits. If you're following still, you're doing a great job. I know this is a lot of information, but pre-65 retiree benefits are offered through your employer, meaning they're becoming actually less and less common. They're really common for large employees, large employers rather, like the motor vehicle space. If you've been there for 20, 30 years, or airlines, for example, who've been there for 20, 30 years. If you have a pension benefit, like from being a teacher, for example, you might have retiree benefits. So that's where we see those being common, usually pretty heavily subsidized by the employer still, which is really, really nice, but they can be challenging to navigate. So every employer crafts their own benefits package. It may bridge you to Medicare. It might drop you at Medicare eligibility. It might coincide with post-65 benefits too. It might offer drug coverage. It might not. It might cover your spouse. It might not. Basically, my point is that they're very, very individualized and personalized to the employer. So it's really important to read that in detail so that you can consider any timelines that you might need to keep in mind, any spousal coverage that you might keep in mind, but usually the costs are a lot lower. So that is one pretty big benefit of these pre-65 packages, but they are, as I mentioned, becoming more and more rare in the market. Okay, so I've referenced a couple times now some other options. They don't make it onto that table of 5 because these are ones that carry a lot more risk. So we don't like to include them in the 5 that we like to walk clients through when it comes to what options are available if you retire before the age of 65. But there are 2 additional options that do exist. The first is a short-term health plan. These are typically available for up to 3 years now. They used to be available for only up to a year because they were meant to cover exactly what the name suggests, a short-term gap in coverage. Meaning if you moved and needed coverage just because you were getting yourself set up, or you lost your job really abruptly and they don't offer you COBRA, so you needed coverage for a couple months. Now they've been extended to be able to renew up to 3 years. And what that has caused is it's caused more push from agents to sell them, as well as more clients to sign up for them because they bridge you even longer than COBRA does, for example. But what's really important to note is these plans are not ACA compliant, meaning they can deny you for any pre-existing conditions. They don't cover most prescription drugs. Most don't offer any mental health benefits, and they probably don't offer a cap on your total out-of-pocket costs, meaning they don't have that out-of-pocket maximum that the marketplace, that your COBRA coverage, that your spousal benefits, or that your current group plan might offer you. So they're very, very different in design. They are really meant to only cover emergencies. That's why they were designed. So if you were in that gap period and you had an emergency, like you broke your leg, for example, you would have coverage. But if you had any instance of a medication or some type of condition that was tracked at a doctor's office or by another insurance company, they can actually deny you coverage. So very, very risky. They're often a lot less expensive. And again, if you are going to an individual agent to make your health insurance decisions, know that they can sell you these plans. A way to possibly identify that is they're often offered by life insurance companies. So if you notice that a life insurance company is the one underwriting your plan, that's a key indicator. If you notice any of these other things in the summary of benefits, that's also a key indicator, or just simply ask the agent, is this a short-term health plan? Or is it something that's ACA compliant? The next and similar kind of alternative option that is just as risky is what's known as health sharing ministries. So these are actually not traditionally they don't follow the same definition that traditional insurance follows, in that they are not regulated. They don't need to share financial information. And again, they do not cap your out-of-pocket expenses, nor are they ACA compliant. So very, very similar risk profile. The way that they work is that a bunch of people actually pool money together through premiums into a pool. And then when there are healthcare services needed, it is up to the discretion of the health sharing ministry to determine whether or not that pool of money will cover those costs. So very, very subjective. No good way of knowing exactly what your costs will be. Again, those monthly premiums may be lower, but is the risk really worth it? So those 2 options, health sharing ministries, as well as short-term health plans, are worth looking out for. Consider them if they are important to you for whatever reason, but know that they do come with some additional risk. Okay, so going back to more formal traditional forms of insurance, I touched briefly on HSAs, and this is a really important planning opportunity and tax savings opportunity for individuals who are pre-65. Once you become Medicare eligible, unless you're still actively employed and haven't enrolled in Medicare Parts A and B, then you can actually no longer contribute to your HSA. So you only have up until that 65th birthday to grow that HSA. And in 2023, you can contribute $3,850 for individuals or $7,750 for families. So that number did increase by about 1,000 to 2,000 from last year. What this does, though, is it means that you're on what's called a high deductible plan. So I showed you some examples of high deductibles available in the marketplace. It can be north of $18,000 in a deductible alone. So that is a consideration if you're on the individual marketplace. You may be subject to paying up to that amount before your plan even starts to pay for anything. So if you are somebody who is a higher healthcare utilizer, if you have planned surgeries, or maybe you're having a baby, or you know that something is upcoming, sometimes the benefits of an HSA are actually outweighed by the fact that you will incur a lot of healthcare expenses. So it's important to keep that in mind. High deductible plans are usually optimized for people who are healthier. So if that's not you, an HSA compatible plan might not be a good option. But just to show you what that looks like, these are numbers from last year. So 2022, the individual and family contributions were a little bit different, but this wouldn't be too far off. This is how that account can grow just between the ages of 60 to 65 with those annual contributions. So this assumes a 6% rate of return. It assumes that you're not withdrawing anything and around a 30% federal tax rate. So you can see this grow over the course of even just those 5 years. So if you are retiring early, if you're healthier, and you have the means to cover that deductible in the event of an emergency, an HSA compatible plan might be worthwhile for you.
Yeah, and just one thing I'll mention too, Christine, as many of you that know me have heard me say, HSAs are one of the best savings tools available today because your contributions are tax deductible, the money grows tax deferred, and if it's used for approved medical expenses, the money comes out tax free. So even though, as Christine mentioned, you can't continue to contribute beyond age 65 unless you're still actively working and enrolled in an HSA plan, you can maintain the account and it can continue to grow on its own. So what I often tell people is if you have access to an HSA plan, you should put as much money into it as you can up to the maximum. And if you can afford to, you should cover medical expenses from other funds and leave the HSA funds alone to let it grow and compound, because it can really make a positive impact on your healthcare planning and expense coverage later in life, even into your 70s or beyond. So HSAs are a great tool. I'm glad Christine mentioned that.
Yeah, of course. And we'll always defer to you or any advisor that we're working with to really determine that strategy. But what we can do is at least paint the picture of what it can look like if you were to enroll in a plan like that. So bringing everything home, the last key thing to kind of address here is the timelines for enrollment so that you can avoid a gap in coverage. That is probably the riskiest thing that could happen, is that if you're actually uninsured during a period of time. Hopefully that doesn't happen. Russ is here to help ensure that these enrollment timelines are met, but it is something that does get added onto your plate when you are planning that retirement. You've got lots going on, but make sure you don't miss the dates and deadlines as required. Typically, it's about 60 days from the last day of your active employment. You can start to plan for this well in advance, though. So 60 days will fly by, especially as you're in your first 2 months of your retirement. So planning well in advance can really ease that transition. You can get a good idea of the plans available in the marketplace any time of the year. The time of the year that the plans switch over is in September, when we get access to the plans for the following year. So even if it's, let's say, June of this year, and you're planning your retirement for year end, December 31st, you can wait a few months, maybe until around September, to know exactly what plan you can enroll in come the new year, but you can actually know that 4 months in advance of that actual transition. So keep that in mind. You can plan really early, ideally a few months. If you do have a heavily employer subsidized plan, or you're transitioning from very different type of coverage, even longer than that is better and more beneficial. So you can paint the picture of what it might cost you in early retirement to transition onto a marketplace plan. But the plan details themselves might change a little bit year over year. So keep that in mind. Some other things to keep in mind is just drug costs are very different from, and I didn't mention this in the slides, of employer coverage to the marketplace or onto Medicare, but drug costs can be covered a little bit differently. And again, those short-term health plans don't cover pre-existing conditions. If you have other household members, don't approach this in an isolated fashion, and in that you, as the one retiring, are the only one to think about. Think about your spouse, whether they're younger or older. They may need to also conduct an analysis to evaluate what options are best suited for them. If you have 18 months until your Medicare eligibility, for example, you might go onto COBRA, but if your spouse is younger, they may not, for example. The same applies if they're beyond 65. COBRA coverage is actually not credible coverage if you're past Medicare eligibility and you or your spouse is not actively employed. So that is something very, very important to consider. Something for those under 26. So if you have any children, there's an increasing need for mental health benefits that does come with marketplace plans, but doesn't come with, those shorter term plans or those health sharing ministries. So do keep that in mind. And also anyone below the age of 26 is often moving around, maybe because of jobs, maybe because they're at school, different states for part of the year. So make sure that you're considering those dates and timelines. When you move, you still have that 60-day window. Also, what's becoming more and more increasingly common is concierge medicine, or just directly paying a doctor for services. Know that in those cases, it's not covered by insurance. So you can individually weigh the cost benefit of doing that if you do want to access concierge medicine services. So just in conclusion, to kind of summarize everything that we went through in the last 40 minutes, which I understand was a lot, but myself and Russ are always here to answer your questions. There's a lot that we went through. There's lots of options for those who are retiring pre-65, but hopefully we help to show you that you're in good hands in evaluating those options. Lots of benefit, as Russ reinforced, for those to contribute to an HSA while even in your 60s. So if you haven't contributed historically to an HSA and want to start, it's never too late, unless you're on Medicare. Pay attention to risk tolerance with those larger out-of-pocket maximums. So really consider that. Don't just think about the short-term fixed costs of a plan. Do plan, though, for those worst-case scenarios, as well as what is more likely, so that you can balance the two and kind of get a good range for where you might come in. And then make sure that you're really understanding the options that are presented to you, understand the risk profiles of them, and really feel informed and confident in the decision that you make. That's why we partnered with Russ. That's why Russ offers this service. The more informed and educated you are about the decision, the more confident you are, and therefore the more likely you are to not overspend on healthcare. There's a lot of data that supports that. So whatever we can do, whatever Russ can do to help reinforce that, simply reach out to him and he'll be sure to put us in contact if the opportunity is right. So thanks for listening. I'm not sure, Russ, if you have any additional questions that you think might be beneficial for your clients.
Yeah, thank you, Christine. This was great. And as you mentioned, it's a lot of information, and I think it speaks to the detail and the considerations that go into what amounts to a very important decision, and not a decision you just can set it and forget it either, because as your situation change, as your drug needs or drug coverages change, there's a lot of benefit to looking at this, if not on an annual basis, certainly on a regular basis. Caribou has proven time and again to be a super valuable partner with me to help my clients evaluate their choices and make more informed decisions. And before we wrap up, I would love, Christine, for you to just tell folks a little bit about who Caribou is and what it is exactly that you guys do. Because while I've seen the benefit, I know people that are going to be watching this aren't as familiar and haven't seen what you guys do. But before we jump to that, I do have a couple of quick questions. You mentioned at the earlier parts of the presentation about how it's increasingly rare for people to retire in the traditional sense. Often they float in and out of work. And so what happens if you, quote unquote, retire prior to 65, you find some other coverage, but then you decide to return to work? How what's the thought process or the decision-making process that goes into that, and how do like different enrollment periods work? How might all that affect a potential tax credit if someone's getting those?
Yeah, really good question. And I'm glad you asked, because that's an important part of the tax credit that I didn't mention when we were going through that. If you have employer coverage offered to you, so let's say you retired, you enrolled on the marketplace, you were accessing a plan with a tax credit applied, and now you've decided to go back into the workforce. You've been offered employer coverage. You're actually no longer eligible for that tax credit. So it's a really key consideration that if you're thinking and holding on to that marketplace plan, you will be asked to pay whatever tax credit was applied back once you were deemed as back active in the workforce. So you cannot access that tax coverage if you have options available to you through an active employer. That's one key thing to consider. Of course, you typically have that 60-day window. Your employer will provide more specifics around anything that might be tailored around them, but usually it's a 30 to 60-day window to make that initial decision and enroll in a plan that they have access to providing to their employees rather. And usually that comparison is a little bit less convoluted in that you might have 3 to 4 different options. But again, take the same knowledge that maybe you gained through this presentation or through an interaction with Caribou of, what's the premium, what's the out-of-pocket maximum and the deductible, what might be my total incurred healthcare costs in a given year, and that can weigh those options for you. Of course, we're always willing and able to help too, but it might be a comparison that you're able to do on your own. So keep in mind those short enrollment timelines, 30 to 60 days usually when you go back to the workforce. Make sure you unenroll in the marketplace plan too. Don't double pay for 2 types of insurance. And then if you have any kids or spouses that you're covering, you need to consider them as well. So that's an extra layer of complexity. Maybe they're staying on the marketplace plan. Maybe they're transitioning over to the new employer plan. So take that into account as well.
Awesome. Thank you. And one final question. As you know, a lot, not all, but a lot of my interaction with Caribou on behalf of my clients thus far has been around Medicare. And I know our conversation today has primarily been around pre-Medicare coverage. So could you speak just briefly about the differences or some of the comparisons between Medicare and pre-Medicare coverage, maybe through the marketplace?
Yeah, well, I mean, it's a whole can of worms, and I'll try to be brief on the subject, but it really is different coverage. We walked through a number of options today that clients can enroll in, but really those coverages are all quite similar, at least those 5 in the table, exclude the short-term health plan and the health sharing ministry, in that your medical and your drug costs are all bundled into one. When you transition into Medicare, everything gets separated. You have different parts and pieces, and you'll pay different amounts for those parts and pieces based on a variety of different things. So you've got your Medicare parts A and B. If you've worked 40 work quarters or you were married to somebody who worked 40 work quarters, you won't pay anything for A, but you will pay for B, and that will be based on your income. Medicare also looks 2 years back. So if you were actively employed 2 years back, but you're not now, they will take that into account. But be sure to contact Russ, who will contact us, and we'll talk about doing an appeal in those cases. So you can look up those income bands. It will affect your Part B as well as your Part D coverage, which is your prescription drug costs. You enroll in that coverage completely separate. You will get a penalty if you don't enroll, and then you also need to enroll in what's called a supplement plan. If you don't want to piece together all these different parts, you can do an all-in-one option, which is Medicare Advantage. It comes with a different risk profile than original Medicare, which is A plus B plus D plus the Medigap plan. And we can talk about that probably in a separate webinar that I think we have booked too. And there's, combined hundreds of options to choose from, considering the different ways you can configure all this coverage. So in summary, a few key things. Drug coverage is standalone. It isn't all bundled into one. So you will pay different amounts for that, as well as currently it's uncapped, meaning there's no limit on what you might pay for your drug costs. That will change in 2025. There's different risk profiles and plan types, which is different than the individual marketplace from Medicare Advantage and original Medicare. And then it's also income based. So premium adjustments on top of that.
Awesome. Yeah, you mentioned, I think we've got a handful more of these types of webinars planned over the coming months. So I'm sure we'll be digging more deeply into Medicare at some point. But I do appreciate that kind of overview. So as anybody that's watching this can no doubt tell, there's health coverage is a deep, deep rabbit hole. There are a lot of factors, considerations, costs, decision points that go into it. And I've always considered myself very good at what I do, but I also recognize my limitations. And that's why I've always sought to partner with subject matter experts and consultants like Christine and her firm, Caribou. Christine, could you just take a moment and tell folks a little bit about the firm that you built and the team that you built and exactly what you do for folks like myself and my clients?
Yeah, of course. And you mentioned it really well in that, advisors by training are not meant to be healthcare experts, right? But advisors are now being tasked with helping clients in more and more areas of their financial lives, tax planning, estate planning, and we basically fill the gap when it comes to healthcare costs. There have been industry tools available that have provided baseline calculations based on, like actuarial data, but it's very surface level. It doesn't provide decision-making support in what health plan options are available, and it isn't really personalized. So what we do is, we like to call ourselves a healthcare planning back office exclusively to financial advisory firms, financial planners, wealth managers, and so on. And what we do is we work with mostly the planning-oriented team members to help them really paint that picture on a client-by-client basis based on very specific factors like your drugs, like where you live, like your income, like any planned surgeries or procedures or anything like that. And we paint that picture for what their healthcare costs are going to look like. We're able to get as granular as the plan details available in the marketplace today in your county. And so we can actually help you with the decision-making support in enrolling in those plans. But one thing that we really pride ourselves on is that we aren't agents. We don't actually sell or underwrite the plans. And we've done that intentionally because we wanted to provide, much like Russ and others in the industry, truly objective advice and not be possibly incentivized by selling you a health plan because the commission is higher on this one versus that one. So that is a really key factor, especially in the Medicare world. And I'm sure we'll get into all of that in that webinar as it relates to some of the risks also in working with agents and the way that plans are commissioned. We've intentionally chosen to separate ourselves from that and just work exclusively on a fixed fee with the advisors for that reason. So in addition to the actual health plan support, we also offer other, cost saving strategies like medical tax deductions. You'll see that in your analysis. If there's ever a generic version of a drug or if filling your prescription via mail order pharmacy is ever less expensive, we'll also include that because our goal, again, is to help you access cost savings opportunities, quality coverage, and really make sure that you feel informed about your decision. Our goal isn't to make the most commission as possible on selling you the health plan.
Thank you for that. Again, I can't say enough what a pleasure it's been to work with Christine and her team. I've gotten, across the board positive feedback from my clients that have gone through Caribou's consulting process. And this webinar is just one of more we plan to do to try to bring more educational information to folks like you so you can be better informed and make smarter decisions about your health care coverage in the future. So Christine, thank you. This was great. I always learn something when I spend time with you. Today was no exception.
Thank you. Thanks for the opportunity to speak to you and your clients, Russ. I appreciate it.
Yeah, absolutely.
See you soon.
Yep.